to Just One Thing for Parents. I was joined this week by Jo Steer to dive into this topic that many parents are dealing with, which is what to do while waiting for an ADHD assessment for our child. So we live in this time where we recognize the need for an assessment in many children, yet families are often having to wait months or even years for an assessment. So what can parents do in the meantime? So, Jo helps us think about having a needs based approach, focusing on the child's strengths and challenges, and starting to put strategies in place before we know the outcome of the diagnosis, which is just necessary for many families. She talks a little bit about the kinds of things that we might be seeing in children if we're looking for this diagnosis, and really advocates for going and talking to teachers in schools before you know the outcome of the diagnosis and giving them a bit of a nudge about making some accommodations in schools. And these accommodations are not rocket science, but they can be incredibly helpful for young people. Things like giving them a fidget toy, allowing them to move about, things like that. But they can really make a world of difference for a young person. So she talks us through some of those strategies. And we talk a bit about medication, but one of the things she says is that even if we are giving medication for ADHD, we would always recommend some behavioral strategies as well. So why not get going with them early on? We talk a little bit also about how ADHD presents in girls. And Jo really is an expert in this area. I know lots of families are going to find this episode really helpful. So please, I hope you enjoy it. So welcome, Jo. Thank you so much for being with us today. The question for you is, what is just one thing that parents can do while waiting for their child's ADHD assessment?
So I think this is such a good question because we're definitely living in a time where more and more people are coming forward and recognizing that they think their child might have ADHD and really feeling a connection with what they're learning about ADHD. And that's putting an enormous pressure on the assessment systems, whether that's in the NHS services, but also even in private and independent practices. So what we're finding is that there are quite long waiting times now, and those waiting times are increasing. So it's really important that we have a think, and we really help families and networks that support children think about, well, what can we do whilst we wait for that assessment, which can be months or sometimes even years in the queue
Isn't that
for.
crazy?
It
But that is
is.
the current situation. Yeah.
And it's so difficult for people.
Yeah.
And I think, like, my main top tip is to just think about supporting the child's needs and really take that needs-based approach. So getting to know and understand the individual profile of that child and what their strengths and challenges are, and trying to think about what the support looks like to help them with their needs. And you may well be using many of the strategies that we know are effective and evidence-based for ADHD, but without that diagnosis being formalized. But in a way, by you've already got a good idea that this is possible and likely if you're on a waiting list, and therefore thinking, right, what support can I access in the meantime? And diagnosis isn't needed to access support at many levels. Now, there are some things that you do need a diagnosis to access, but in terms of some of the big charities in the UK that we have, the ADHD Foundation or Addis, there's, you don't have to have that diagnosis to be able to go on their web pages, use all their amazing resources, make contact with them if you need to. That's absolutely fine to do that whilst you're waiting,
Yeah.
as a parent.
Mm.
But
And when thinking about needs, I suppose how a parent might work out what the need is to say, well, what
Mhm.
was the problem? Like, would it be that? Like, what actually
Yes.
brought us to this point of thinking
Yeah.
that
Yeah,
this?
where are the key struggles
Yeah.
and worries? What do I feel like my child is finding harder than I would have expected, or that perhaps I've seen other children of the same age, manage? And, typically for ADHD, that might be things like, well, they seem like they are quite impulsive. They, really making these decisions without thinking them through. They're not very good at waiting. They're really impatient. or it could be more of that hyperactivity, that constant need for movement, fidgeting up and down, really busyness physically and mentally. So we talk about a busy brain quite a bit. Or in the inattention realm, it could be those, really struggling to organize themselves, to focus for, the expected period of time for a child of their age and ability, being able to remember their things, not lose things all the time. Those kind of key parts, they are very likely to be some of the needs that a child who is waiting for an ADHD assessment has. And actually, there's one last one, which is a big one that we don't talk about as much because it's not in the criteria, but thinking about managing emotions, so emotional regulation. So, those big feelings and becoming really dysregulated and really struggling. So whether that's expressed through angry behavior and shouting and or upset and distress and tears, or actually just real retreat and kind of not withdrawing from people around them. But that emotional regulation is a really important part of the picture.
And I think one of the things that happens with ADHD is because people know that there is a medication for ADHD, there is an idea that we have to wait until we get the medication. Could you just say a little about the medication? Like, what does it do and what doesn't it do? And is it essential?
Yeah, so medication for ADHD has a good evidence base. It can be very effective, but not for everybody. And the real target of the medication is the focus and then the attention, so it can help make improvements in that area. But what I would say is that it's actually really important that strategies are used and support are used alongside medication. And typically, prescribers will ask what strategies and support you already have in place and have been using before opening up a conversation about medication. And they will want to hear that you're already making adjustments, or that school are putting some support in place for a child alongside that medication, because actually it's really important to do both together. And that will be checked out. So it's definitely worth making a start on this side of things before the assessment, so that when you get to that endpoint and have that assessment, and if there is a medication conversation, you're really in a great position to be able to say, well, I've been doing all of this, and actually we're still having these really big concerns, or this has made a difference but this hasn't, and really think that through.
Yeah, which is,
And lots of people choose not to have medication. I suppose
yes.
that's the other thing.
Yeah. And there
Yeah,
are side effects and it doesn't work for everybody. And
yeah.
I think it really supports what you're saying
Mm,
about not waiting until you have the assessment,
mm,
because it's not a magic solution. Actually, it doesn't solve everything. It can
yeah.
help with focus, but it doesn't teach kids how to organize themselves well, or
No,
manage their time, or
no,
many of those things, does it?
no, it's not magic.
It's not, unfortunately. Yeah. So, yeah, what kind of things can parents do?
So I think one of the big things that I wanted to highlight is about opening up and having conversations with school.
Mm,
Children spend, a large part of their time every day in a school setting, and typically ADHD really can have quite a big impact on school life, on learning, on friendships. And so even whilst waiting for that assessment, it's really important to get that conversation up and running with school. And schools are very good at being needs led. That's a big part of what they do. And so making sure that there is a conversation about what your child's needs and challenges might be in the classroom or in the playground, and then really thinking with school, well, what support could happen. And we tend to call this support in schools reasonable adjustments. That's the kind
okay.
of first line that's often used. And there's a really great document on the internet that you can look up. It's called 101 Reasonable Adjustments for ADHD.
Oh, I'll put a link to that in the notes.
Yeah, that would be great, because it's loads of brilliant ideas that lots of which don't cost schools a lot of money. They're kind of little tweaks that can happen in an everyday classroom that can make a really big difference to children with ADHD. And getting some of that up and running, depending on the particular concerns of the individual child, is absolutely essential. And we wouldn't want anyone to wait for a formal assessment and diagnosis before putting that support in place. It's really important that we get going with that soon, because, you know, as I said, the wait for the assessments can be so long that these are, you know, really important years of children's education and their lives. So we want everyone to be working to support them as soon as possible, and having that conversation with school and thinking about what it looks like, is really important. And, you know, schools are very good. They often know what they need to do, but sometimes they might need a bit of an extra nudge from a parent. And so
Yeah,
don't be afraid to go in and ask and
yeah.
find out what they're doing, because sometimes schools do things without necessarily even naming it. They're
Mm.
actually just, it's kind of part of the way that a classroom runs. So like access to some fidgets as an example, things for a child to be fidgeting with, or sometimes we have these big elastic bands that wrap around the bottom of chairs so that children can move their feet whilst they're sat at their desk. And you know, much better than rocking on your chair, which we know can be a real issue. And so how much can the school, you know, put in place or be doing if movement's a big issue? Is that possible? Or giving a child like an exit pass if they're at secondary school, so that they can get up, go for a, you know, walk around the school and then come back. And appreciating and understanding that that movement is actually really important to help that child with their learning.
And it always strikes me that many of the adjustments and strategies for ADHD are very basic, small little tweaks, aren't they? They're
Yeah.
not like big rocket science or big ideas. It's about sitting somewhere different, you know, thinking about how much time you're focusing, having a movement break, as you said,
Yeah.
repeating instructions. Those little things can make a big
Yeah.
difference, can't they?
Yeah, definitely. And one of my favorites is really getting teachers to go and check in with an individual child after a big instruction, because often every lesson begins with a whole class input with the teacher at the front. And that's so often the time that a child with ADHD will struggle to focus and stay focused on that one teacher talking, and particularly if they go on and on,
Yeah.
and then suddenly the teacher says, right, that's it, in twos or in small groups, get on with this task. And, you know, typically children with ADHD tell me that they've got no idea what they need to be doing because they've lost their train of thought. And so they might ask the child next to them, which can or cannot be helpful depending on who you're sat next to. But actually, if a teacher is proactive and knows that that is likely to have happened and just goes straight over to that child, does a really quick recap, or has a little something that they can put on their desk with their instruction, that just takes all of that out of it. And it's moments, it's not a big long piece of input that the teacher will need to redo.
One of the things I've noticed is that when kids move from primary to secondary school, it's a huge jump because in primary school, typically in this country, anyway, in the UK, you have one teacher, you know, books go in the same place, a lot of the scaffolds
Mm.
around the kind of executive function skills. And we have a podcast coming out about executive function skills, actually, that people can listen to, are there in primary school. But then you move to secondary school and suddenly they've all gone. And you're having to move from class to class. You're having to remember which books to take. You're having to manage your time and all of those things. And it reminds me of a message I got on social media from a parent who was saying that my daughter's just gone to secondary school, never really been any issues, but suddenly she's getting detentions all the time. She's coming home, she's a bit frustrated. She's emotionally quite up and down. Could this be ADHD?
Mm. Yeah, and this is such a typical story that we hear, and particularly for girls, that I think what happens is in primary as well, they might well be aware of some, you know, of the difficulties that a child experiences, but often primary schools are very nurturing. They, you know, have these systems in place, and as you say, there are less complex demands for children in a primary school. And then suddenly they move up to secondary and everything changes, and those organizational demands go through the roof, as well as some academic and learning demands, and then also social demands. It is a much more challenging environment. You're with loads of new people that you've not met before, and that can often kind of reveal some of the difficulties that perhaps have been really well scaffolded and supported in a primary setting, but then begin to emerge. So in a way, the child's ability to manage is exceeded by the demands that are then
Right.
placed on them. And so we sometimes that then appears as like an anxiety, or you know, difficulties around emotional well-being, and those children might come forward for some support in that respect. Or sometimes absolutely we're straight away thinking, oh gosh, could this be an ADHD that we've missed or somehow done a great job of supporting at the younger years,
Yes.
and now is more obvious.
Yeah. And often that can be for girls. Why do we tend to miss girls in the younger years?
So I think girls with ADHD, what we know is that they can present a little bit differently. So we perhaps might miss them because they are less hyperactive, so less physically hyperactive.
Mm.
So they're perhaps not coming to teachers' attention in that same way, as that they're not kind of up and very visible and bouncy in the classroom. They are more
Brackets,
likely to
not
be.
causing a problem.
Yeah, exactly.
Yeah.
They're maybe sitting there, they're looking out the window and daydreaming, but they also somehow find a way to manage to get on with things. So like I said, they might use some of their social skills to ask the person next to them for a bit of help.
Yes.
And so the teachers maybe not as aware, but also we know that teachers, parents, you know, the public generally have a perception that ADHD is something that mainly affects boys and something that looks like bouncing off the walls. And so that really disadvantages us, because we know that A, girls don't look like that, and B, girls actually can have ADHD, and they do have ADHD, but we're not kind of putting it out there as a hypothesis, and you know, thinking, oh, could that be what's going on for this girl? It's much less likely we would think that.
Yeah. I heard the other day somebody describing ADHD, changing the ADHD to ADHA, attention deficit hyperactive ability, which
Interesting.
I thought was a really nice reframe, because there are so many incredible benefits that go with having an ADHD brain, aren't there?
Absolutely. And I think the other thing that, I mean, personally, if I could change the name, I would also take out the deficit, because
Yes.
I think the thing that we know is that it's not that children or adults with ADHD can't focus, but they struggle to regulate their focus and
Right.
attention. And so, you know, when you hear ADHD, attention deficit, you think, oh, deficit of attention, or they can't focus. But
Yeah.
actually there are many people who have ADHD who can focus if they are interested, motivated and engaged. And then we have these amazing pockets of hyper focus where they can really get in the zone and might struggle to regulate their attention off of what they're
Yes.
interested in, but they can create, you know, amazing Lego displays that they spend hours on, or design dresses, or whatever it might be. And that can sometimes put us off the scent a little bit and be quite
Yeah.
confusing, because it's that unpredictability that then makes us think, oh, maybe they haven't got ADHD because they've been in their room for 3 hours doing Lego.
Yes.
It's confusing.
Yeah, really confusing. Yeah,
Mm.
I remember hearing, and this really makes sense for me actually, even now in my older years and all the experience I have of executive functions and ADHD. But people with this type of brain need a deadline upon them to really get down to it. And so they're either internally motivated, in which case their brain is in a great way, a great kind of functioning way in order to get something done. And as you say, they can really get into that flow state and be really, really
Mm.
productive. Or if it's something where they're not internally motivated, they're not really enjoying it, they need a deadline in order to do it. So that's that. It's complicated, isn't it?
It is complicated, absolutely, and also so so much individual difference as well, and so important to recognize and understand that as a parent or as a teacher, or even as a psychologist or a therapist, that if you've met one child with ADHD, you've met one child with ADHD,
Right.
and the different strategies apply to different children. And just because last year in your class you had a child with ADHD and fidgets worked and they were brilliant, doesn't mean that next year when you have a different child who also has ADHD that they'll work. And that's hard. It's hard work, but it's also important to understand that, and for parents to understand that. They might know someone else who's got a child with ADHD and then be thinking, oh, but my child isn't exactly like that. But actually we know there are many symptoms within the ADHD package, and not all people will have all of them. In fact, it's very unlikely that people will have all 18 symptoms that are in the criteria.
So it really brings us beautifully actually back to what you said at the beginning when we're thinking about, if you are waiting for the ADHD assessment, there are many things you can do. And what your top tip really is to think about what are the needs of your child and what little tweaks and strategies and adaptations can you make and can the teachers make, and also understanding. I think that's one of the big things about ADHD. It's what can I do to understand this behavior differently? And I love this idea that children are always, children will do well if they can. And if we can hold that in mind, with your advice of think about what are their needs, where is there a mismatch between what we're expecting of them and what they're able to deliver,
Yeah.
we can do a lot.
Yeah, how can we give them a helping hand with those little challenges so that things are go a bit better and are easier? Definitely. I completely agree. I think that's a really good way of kind of summarizing it all together.
Oh, Jo, thank you so much for coming on today. I think what you've said will be so helpful as we wait for the government to. There is a big initiative in the government, isn't there? There's been a new, what have they called it? Not a green paper or something,
It's a
but
task force,
a
isn't it? An
task force,
ADHD task
ADHD
force.
task force. So
We'll
let's
see what
hope
they say.
that there will be some changes. But in the meantime, there's some great advice. Thank you so much for coming on today.
Pleasure.